Is your brain stuck in stress, fog, or fatigue? In this episode of the Healing Wellness Show, I'm Dr. Karim. I'll have Dr. Haddad unpack how neurofeedback is helping people naturally retain their brains. And it's not only doing that, it's improving sleep, mood, focus, and many more things. And joining me today is one of my colleagues and experts in this field. It's Dr. Haddad. I'd like to welcome him to the show. So why don't you tell us a little bit about yourself there, Dr. Haddad?
Thanks, Dr. Karim. Thrilled to be here and very excited to share how neurofeedback is helping our patients. A chiropractor for 5 going on 6 years now, and I first learned about neurofeedback when I was at a continuing education, connecting how the brain is functioning to how our body interprets pain and how we can help manipulate the brain to control some of those pain signals that we get.
Well, we're going to be asking here some questions that some patients have asked in the past or right now. So I'll be asking Dr. Haddad these questions as they pop up for us on the screen. Dr. Haddad, why don't you just tell us just briefly, why exactly is neurofeedback and how does it work?
So neurofeedback, the couple biggest things are it's non-invasive and it's drug-free. You won't have any of that. When we train our patients, we use real-time electrical data with our computer. It then shows the brain better patterns to use than what it's using. It's essentially biofeedback for the brain. Patients can actually see their brainwave activities on the brain while they're watching a show on Netflix or a documentary on YouTube, and it helps the brain to operate more optimally.
Wow. So we're like literally showing the brain how to heal and improve on its own function?
Pretty much, yeah. That's exactly how it's working. And over time, with consistent training, we can see changes in mood, focus, sleep, overall mental resilience, and a few other things as well.
What conditions do you typically see respond well to neurofeedback?
Wow, there's a lot of those. I mean, anxiety and depression are probably some of the biggest two. Sleep is probably a very close third. There's PTSD and trauma-related things we can do, ADHD, ADD in both kids and adults, brain fog, memory issues, and even some migraines can have or be helped with neurofeedback.
Wow, that's a broad spectrum there. How soon do patients typically notice improvements?
Well, every patient's different. We have some patients that can see some sort of improvement in the first couple visits, especially when it comes to sleep. If you can't get to sleep after that first treatment, you may get to sleep pretty easier, or you may not wake up as often. Other conditions may take 10, 20, maybe even 30 visits to start to notice changes.
Wow. But you can't tell until you do the scan?
Yeah, no, we need a brain map first off. And so we put a funny looking cap on your head that just measures all the electrical activity that your brain produces. And then based off of that, we put together a treatment plan that best fits that patient's individual, because it's more than just the electrical activity in the brain. We look at hormone imbalances. There's nutrition we have to consider as well. And then once we put that together, then we have a better idea of how long it might take, but every patient is different.
So why don't you walk us through a typical session? What does that look like for someone who's never done neurofeedback before?
Yeah. So I mentioned the brain map earlier, where we put the cap on and we measure all the data. Then when you're actually going through a training session, you're going to be in our neurofeedback room watching something on Netflix. You're going to have 4 leads that are going to be attached on various places on your head. And those are going to be the areas of the brain that we are training. You're going to have a pair of glasses on that are going to have some flashing lights in them, as well as a pair of headphones. And then all you have to do is watch your movie or your TV show that you have picked out for about roughly 20 minutes. And that's the session.
That sounds relaxing. Are there any side effects?
No. Typically, if there's going to be a side effect, someone might have a headache. They might feel a little drowsy afterwards because it can be quite relaxed. But typically past that, there's really no side effects.
So just watch a movie or a show?
Watch a movie or a show. That's it.
So why did you decide to offer neurofeedback at Iowa Wellness Center and Family and Sport Chiropractic?
It kind of goes back to where I originally got interested in neurofeedback with that brain-body response. We deal a lot with neuropathy patients here at the Iowa Wellness Center and Family and Sport Chiropractic. And with that, a lot of those people have those pain sensations where the peripheral nerves can't communicate to the brain. If you kind of think of riding a bicycle, we never really forget how to ride a bicycle. The first time we do it after 20 to 30 years, we might not be the best at it, but with a little bit of practice, we can remember how to ride the bike. Same thing with the brain. If nerves aren't sending those signals to the brain, we got to make sure the brain's in a healthy state to receive those signals and interpret them properly rather than pain, numbness, or tingling.
Does it help with like chronic conditions, chronic pain conditions, especially like, I specialize in neuropathy or stress-related conditions?
Oh, absolutely. Yeah, I just touched base on the neuropathy one, but chronic pain kind of goes along the same way. The brain's stuck in a pattern, and we have to help the brain correct that pattern. And then in terms of stress, we actually have an at-home training device that people can use while they're at home, on the road, on a flight, that have a bunch of different protocols built into it for, relieving anxious episodes or depressive episodes, help people get to sleep. There's really a lot we can do with that.
Is that on top of their protocol as well, or is that?
It can be, yeah.
Oh.
Now we have some people that just do in clinic. We have some people that are in the clinic and at home because everyone's different. Everyone has different needs.
So who would you say makes a great candidate for this?
Everyone, in short. Anyone dealing with any type of chronic stress, past brain injuries. We've learned a lot about concussions in recent years. If you ever had concussions going through sports, there's ways we can help with that. Even people who maybe feel like, good, but just want to sharpen their mental performance can see benefits from neurofeedback.
Is there patients that you wouldn't do neurofeedback on?
In very rare circumstances, epilepsy would be one of them because of the flashing lights. That would be someone that we probably would be very cautious to not doing neurofeedback with. But other than that, no. We can do neurofeedback on pretty much anyone.
So going back when you're saying everyone except obviously this category, so it kind of seems like it's therapeutic and performance enhancing.
Yeah, absolutely.
So let's bust some myths. Is neurofeedback like brainwashing or mind control?
No, I'm not going to be able to make you dance like a monkey or vote a certain way. That's absolutely not how neurofeedback works.
What if someone is on medications, or can they still do neurofeedback?
Yeah, neurofeedback, we work in tandem with people who are on medications. I'll just take anxiety, for example. If you have an anti-anxiety medication, we can work on different areas of the brain that can limit anxiety. And we've even had some people completely be able to get off their depression medications.
So what kind of commitment does this look like or require?
So the average patient, we look at about 2, maybe 3 sessions a week. And then that can be supplemented with that at-home treatment I'm talking about, taking a day off somewhere in the week. Because this is exercise for the brain, just like going to the gym. You may go to the gym every day, but you're not working the same muscle every day. We have to give the brain time to recover as well. So 2 to 3 sessions a week in clinic, up to 2 to 3 days outside of the clinic too, with the at-home stuff we use.
And then how do you measure or know that they're doing better?
Yeah, and this is the hardest part for our patients to kind of come to terms with, because when we're starting to do the neurofeedback, it's about 50-50, what the patient's feeling and what they want, and then the other 50%'s that brain map. But as they're getting better, it's more and more how the patient is feeling rather than what the brain map is showing. Because everyone's different, it is possible, and they've done research on this and found it, that you can train anxiety into depression if you go too far, because you're going to swing the pendulum the other way. So I really talk to the patients, pretty much every time they're in here. How are you feeling? Where do you feel you're at right now?
So, in neuropathy, will tell my patients, you're here, you might get worse before you start to get better. Is that something also that could happen? Or
yeah, it's not that they're getting worse. They might be feeling a little worse because their body's starting to transition a little bit from where they're at to learning these new patterns. It can be a little stressful on the body. So you may feel a little off. I wouldn't necessarily say they're going to be feeling worse.
So you mentioned earlier doing this scan with the cap. So are you doing this like once a year, or is it just one and done? How often are you doing that?
It depends on the case. Typically, though, about every 10 visits is when we would do the brain map.
And what are you trying to see on that?
It's simply to set new baselines based on how the patient's feeling. So I have the original brain map and how they felt. I have the second one. Okay, are they feeling better or are they staying the same? And then that can help me adjust the treatments to different areas that might be more successful for them.
That's amazing. Do you have any patient success stories that you could share with us?
Yeah, one of the more recent ones, a patient in, her husband was going through neuropathy treatments, but she had mentioned in passing that she was having trouble with sleep. So we got her in, we did a brain map. Now, she could not come into the clinic and we could only use the at-home device with her. Over the course of about 6 to 8 months, we were able to make it to where her thoughts were no longer racing as she was going to bed, preventing her from getting to sleep. And so now she can, when she goes to bed, she can get to sleep. And if she does wake up in the middle of the night, she's able to get right back to sleep.
That's great. All right. Any other stories that pop up in your head?
There was this other patient, forgot her name off the top of my head, that she had mentioned she was being very quick to anger. Things would trigger her really easily and she would snap at her husband, at friends, whoever. And so I did another brain map because we hadn't done one in a while. And I started to work the areas of the brain that kind of control emotion a little bit. And after, I'd say about a month of doing the treatments about twice a week, she reported that while she was still getting angry at the things, it wasn't getting to the point where she was snapping at people. And so she was able to control that outburst a lot easier.
That's amazing. So what would be the most common conditions that are coming in that you're using neurofeedback with in the clinic?
I would say it's a tie between sleep and like an anxiety depression. Those are probably the 3 biggest ones.
So to our listeners, thank you for joining us on the Healing Wellness Show, sponsored by Iowa Wellness Center and Family and Sport Chiropractic. And if you wanted to schedule a consultation, or visit with Dr. Haddad, you can see the number on the screen or just give us a call and we'll connect you. But until next time, stay well, stay balanced, and take care of your brain. And we'll see you soon.